Hello, everyone. Hi. First, I would like to start by saying it was a pleasure meeting all of you guys and hearing all your stories. And me, as a family advocate myself, I learned so much invaluable information here at the Mind, and I am so grateful for this opportunity. And as you all know, LEND is supported by the Department of Health and Human Services, language, culture, and autism. So today I'm going to be speaking about navigating the complex world of autism diagnosis and how overwhelming it could be for any family. For Spanish speaking families, the journey often comes with additional challenges and barriers, language barriers, unfamiliar systems, and the need for culturally relevant resources. Through my research, I have, went to different support groups. I'm reviewing scholarly articles, participating in clinical observations, conducting developmental screenings in our Spanish communities, and attending Spanish-speaking support groups as well. So I will be sharing my experiences navigating the Spanish community in the world of autism. My very first project that I got involved with at the Mind was a series called Vamos a Platicar, which is Let's Talk. And I was able to work alongside Luz and Liliana Vargas and, of course, Maribel Hernandez, who wrote and created the manual for Spanish speaking families. It is a very in-depth manual. It covers so much. It covers like daily life, accepting the diagnosis, supports for the parents, learning and understanding the school systems, EBPs, ABAs, you name it, basic implementations, reinforcements, visuals, positive thinking for parents, asking for help. It has so many wonderful ideas and supports in this manual. All four of us, we brought our minds together and we read it and we proofreaded it, and we made sure that it made sense, that it was in plain language, and that it was culturally relevant, and that it was understandable. And I know it's going to be another tool for the Resource Center, and also I'm pretty sure it's going to be included in the Mexican consulate information that is passed out and given out, which is wonderful. My favorite part of the community that I participated in was going to the Mexican consulate. So at the Mexican consulate, we were screening children for developmental delays. And this was with Cecilia Corral. And we got to meet so many wonderful families and kiddos. We would start by introducing ourselves and reaching out directly to these families, and we would tell them we're from the Mind Institute and with UC Davis and LEND, and we would give them a lot of information for their kiddos, ages 1 through 5, and we would ask for their permission if they would like to have a screening for any type of developmental delay. And so we would, so if they agreed, we would have this screening tool that we would ask and play with the kiddo and then just mark everything down. And it was a lot of fun. At the end of the screening, we would go over the results with the parents and give them the screening sheet, which, if there was any area of concern, they had something in hand to show their primary care provider, their pediatrician, and they can address that issue specifically and, dive deep and see exactly what that might mean if it was autism or any other developmental delay. We would also give them a lot of resources. Another wonderful resource was the CDC Milestone app, and Cecilia would literally give out her phone number to these families all the time so they can call her and ask direct questions. She was just wonderful, helping them out. It was I think this by far was very impactful to them. This app, I wish I had it when that I knew about it when my daughter was between 1 and 5. These are actually pictures of her right here. And I didn't really know, since she was highly verbal, that there was something there. That's why the Mind Institute in this program just was very eye-opening. So just to talk about the CDC Milestone Tracker app, I think it's a wonderful tool for parents, and it monitors the child's developmental stages from birth to age 5. It also comes in Spanish. And they monitor the talking, moving, social skills, and it uses easy checklists and examples. And then one of the biggest benefits is that it alerts parents to early signs of autism or any other developmental delay. If the child is not meeting the certain milestones, the app encourages the parent to go talk to the pediatrician sooner, and this can lead to earlier support and better outcomes. It's just a very empowering tool. Like I said, I wish I knew about it before. So this was wonderful. We were able to actually download a bunch of these onto at the Mexican consulate, some of the families there, and they were like, "Oh yeah, okay." So this is a great tool and resource. So over the past 2 decades, autism rates have risen across all communities, including the rapidly growing Hispanic population in the United States. And however, most training programs for autism, such as OASIS, which is an online and applied system for intervention skills, have been developed and tested primarily within non-Hispanic or English-speaking families. OASIS is a web-based program that teaches parents how to use effective evidence-based strategies to help their children with autism learn new skills and manage challenging behaviors. So this research highlights that while OASIS is beneficial for Hispanic families, cultural and linguistic adaptations are needed to improve its effectiveness. Through collaboration with Hispanic families and communities, leaders, the authors identified important modifications such as delivering materials in Spanish, involving extended family, incorporating Hispanic cultural values to make the program more accessible and more relevant. The study underscores the importance of adapting evidence-based interventions to fit the cultural needs of diverse families, ensuring that all children with autism and their caregivers can benefit from these resources. So the OASIS Parent Training Program helps families of the children with autism learn effective teaching and behavior management skills. This work highlights the importance of tailoring autism interventions to fit the cultural needs of diverse families. So this is an example of how important it is to be culturally relevant so they can actually succeed and practice these techniques. And my last slide, this was actually really fun. It was such a great and fun event. It was during Easter, and it was here at the Mind, and there was a lot of families that came together. They all spoke Spanish, and it was such a warm, inviting environment. It was wonderful. So I'm going to conclude with this. So in conclusion, while Spanish-speaking families face significant challenges navigating an autism diagnosis. A lack of culturally relevant practices and therapies tailored to their unique needs can hinder full benefits. However, there is remarkable strength within the Hispanic community. Their tradition of sticking together, supporting one another, and forming strong support groups proves success overcoming the complexities of the system. And by recognizing both the deficiencies and the strengths, we can advocate for more inclusive, culturally sensitive services while also celebrating the resilience and unity that empowers these families to succeed. So together we can work towards a future where every family, regardless of the language background, has access to the resources and supports they deserve.
The UC Davis Mind Institute was founded in 1998 with the promise to reduce and prevent the disabilities that can be associated with autism and other neurodevelopmental conditions. Every day, our clinicians and researchers make progress on that promise. Our groundbreaking research on autism, Fragile X syndrome, chromosome 22q11.2 deletion syndrome, ADHD, and other conditions associated with disability are helping affected individuals achieve their fullest potential. Please visit our website or our social media platforms to find out more about current studies, upcoming events, and how you can help make a difference.